Welcome to The Explainer. Today, we're diving into a real medical paradox. How does a condition that's famous for causing uncontrollable bleeding actually lead to a patient needing major bone surgery? It's a fascinating question, right? It sits right at the intersection of hematology, the study of blood, and orthopedics. We're going to trace that entire journey, from a tiny genetic mutation all the way to the operating room. So to really get our heads around this, we're going to break the whole thing down into 5 key stages. We'll start with the basics of the disorder and follow it all the way to the high-stakes procedure that can completely change a patient's life. Okay, first things first. Before we can understand how this condition causes so much damage, we've got to get the fundamentals of what hemophilia actually is. So the crucial thing to remember is that this isn't something you catch. You're born with it. The body is literally missing a key ingredient that it needs to form a proper blood clot. And because it's an X-linked disorder, it overwhelmingly affects males. What's really interesting is how specific this all is. There are 2 main types, A and B, and the only difference between them is which one of these little proteins, these clotting factors, is missing from that complex chain reaction that stops us from bleeding. And just to give you some perspective on how common this is, hemophilia A, which is the more common type, affects about 1 in every 5,000 males across the globe. Right, and hemophilia isn't some one-size-fits-all condition, it's a spectrum. The severity of it is all based on how much of that functional clotting factor a person actually has. You can see right here on the chart, someone with severe hemophilia has less than 1% of the normal amount. That can lead to spontaneous bleeding without any injury at all. So how in the world does a bleeding disorder lead to such a severe joint problem? Well, this is where we get into something called hemophilic arthropathy, which is just a technical way of saying joint disease that's caused by hemophilia. The connection here is direct, and it's incredibly destructive. Instead of bleeding from, say, a cut on your arm, the bleeding happens internally. And it most often happens in our big, flexible joints, like our knees, elbows, and ankles. And this is what kicks off a truly devastating feedback loop. It's a vicious cycle, really. Every bleed irritates the lining of the joint, which causes inflammation. That inflammation then damages the cartilage and the bone, which makes the joint weaker and, you guessed it, even more likely to bleed in the future. Over years, the joint is just destroyed from the inside out. And eventually, the damage gets so bad that other treatments they stop working. The patient is left with chronic inflammation, their joints are deformed, and they're in debilitating pain. At that point, a major surgery like a total joint replacement becomes the only real option for a better quality of life. So what does this internal destruction actually look like to a doctor? Well, medical imaging tells a very, very clear story. I mean, wow, this series of images really shows the whole surgical journey, doesn't it? That initial X-ray reveals this severe arthritis. There's almost no space left in the joint at all. Then the CT scans give you that 3D view of just how bad the bone destruction is. And finally, in the last images, you actually see the surgeon removing the damaged bone and putting in the new prosthetic joint. And doctors are trained to look for these very specific telltale signs in the images. The chronic bleeding actually reshapes the bones over time. The kneecap, or the patella, it can start to look squared off. The notch at the end of the thigh bone gets wider, and the bone density thins out. These are all classic signs of advanced joint damage from hemophilia. Okay, so we understand the problem. But now we get to the central challenge. How do you safely operate on a patient whose body can't stop bleeding? Let me tell you, the preparation before surgery is incredibly intense. Yeah, let's be clear, this is the absolute opposite of a routine surgery. It is a high-stakes, meticulously choreographed event. It requires this seamless teamwork between blood specialists, surgeons, anesthesiologists, and the intensive care teams. So before a patient is even cleared for surgery, they have to go through this entire, rigorous checklist. The team confirms the exact type and severity of their hemophilia, they screen for any infections, and then, most critically, they search for a really dangerous complication known as inhibitors. And that word, inhibitors, is what gets everyone's attention, because these things are a huge problem. They're actually antibodies that the patient's own immune system can create against the clotting factor treatment. So if these inhibitors are there, the standard therapy just won't work, and that could turn a controlled surgery into a fatal, uncontrollable bleed. All right, so finally, let's get into the game plan. How do they actually manage the bleeding risk during the operation itself? This is where the medical strategy gets really sophisticated. The strategy is really a 2-part approach. a 1-2 punch. First, you replace what's missing by infusing the patient with the clotting factor they don't have. Second, you use these adjuvant or helper medications to protect and strengthen any clots that are able to form. And just stop and think about the goal here for a second. The team's job is to bring the patient's clotting ability from less than 1% all the way up to 100%, basically the level of someone without hemophilia. This creates a safe window for the surgery to happen, but it requires constant, minute-by-minute monitoring. And this is where those helper drugs come in. A really common one is tranexamic acid, or TXA. Now, it doesn't help form new clots, but it acts like a shield for the ones that do form. It basically stops the body's natural clot-busting process, which preserves those life-saving clots made by the replacement therapy. So when you put it all together, for these patients, orthopedic surgery is really a medical masterpiece. It's this delicate tightrope walk between a catastrophic bleed on one side and a dangerous thrombosis or blood clot on the other. It's this intricate balance, managed minute by minute by a team of experts, that allows surgeons to fix a mechanical joint problem in a patient with a profound bleeding disorder. It really makes you wonder, what other medical paradoxes are we going to solve next?